Hello, my name is Ndikubwimana. I'm currently studying at Southern Hampshire University, Soul Capital Program. I am a developing researcher in quality health improvement. Today, I'm going to talk to you quality health improvement in general, especially in developing countries. And I'm going to tell you some of the risk factors associated with poor quality health improvements. I'm going to tell you some interventions that stakeholders should put in place, and I'll be trying to pass through some priority areas that we need to put more emphasis in, as well as telling you some of the ways of addressing the issue of poor quality improvements. According to World Health Organization, the status of healthcare in developing countries is still not on better performance because these countries are facing a lot of challenges. Developing countries are countries that have low income, so due to the fact that these countries have low income, even the investment in the field of health is still low. Also, due to this extent, they don't have enough skilled labor force. They don't have access to all technology. They don't have enough equipment. So you will find in these developing countries, they try their best to utilize available resources, but they still have limited income. They still have limited skilled labor force. Because in health industry, health professionals are expensive. The doctors are being paid. They need a lot of payments. So you will find all doctors who are working in these developing countries. Some of them are part-timers. They are working in they are working in many facilities. You will find one doctor is here, shifted there, so which reduces the quality of health being offered. So this is something that is still an issue in developing countries. Also in developing countries, they are still having limited number of health professionals. You will find one health professional serving large number of patients, especially in Rwanda. It's something that we really need to think of. These countries should work together with these developing countries in health equity, so that they can help them, they can give them access to materials. Also, they can even help them by training the labor force. Also, even the income, the financial income to pay employees is still low in these developing countries. So the court health delivery in developing countries is not well addressed. Is not on high performance compared to the developed countries. Also, I would like to talk to you about risks that patients experience as a result of poor quality health. So, according to Channel 2019, it has been approved that patients experience a lot of problems, a lot of challenges due to poor quality health. Some of them include adverse events. Adverse events like some of them include falls, due to the fact that some facilities do not have advanced equipment like all the beds, so patients can fall, which can include the injuries. Also, there is hospital-acquired infections increases due to poor quality services. You found, for example, in COVID, some hospitals in Rwanda were like able to receive a lot of patients, and they were not able to control the social distancing, which was also something. You may go to hospital asking for care, you end up getting a disease there. So this is something that is also a problem. There's also another risk of surgical complications due to the lack of enough materials, enough equipment, enough health professionals. So many people have surgical complications. When they are doing surgery operations, doctors may be rushing with time, and you end up patients having complications in surgery. Patients experience the problem of poor quality service in general. They are not being treated. The professionalism in healthcare institutions is something that is a risk. Imagine if you are sick and you meet with a doctor, the tone he's using is not even caring you, he's not even understanding your pain. So this is another risk which can increase even the time of hospitalization for the patient. So patients should be the patient's concerns should be addressed because healthcare professionals are there to care about people's health and wellness. Also, I would like to talk to you about priority area that need much emphasis in terms of quality health improvement. According to National Academic Press, Washington DC, there are different areas that we need to tackle more in health services. Especially we need to care about children health. Children health is something that healthcare professionals should think of, because all of us we were children when we were young. So if we should not have been cared in our childhood, it should be a big concern for our life. So we need to care about that. Also, there is a diagnosis process. The diagnosis process is the process of knowing the disease that the patient is having. This is something that health professionals should care about. There is also care coordinating. Also, always the care, the way we are delivering care, the way health professionals are caring patients, how they talk to them, the tone they use, they need to improve in that, because when you are a health professional, you need to have a heart. For instance, in Rwanda, before being a doctor or a nurse, you need to do you need to do an exam for license. They test your ethics, your health ethics. How passionate are you? Are you able to serve patients with your heart? So this is something that we also have to improve on. Also, there is self-management. Also, all health literacy. We need to put more emphasis in health literacy. We need to train people in some health tips, like doing sports, like caring about their lives, eating healthy meals. It is also something that we need to also put more emphasis. Also, there is cancer screening. Cancer screening, we know that many people die of cancer in the whole world. So we need also to focus on cancer screening, because many people, they have cancer but they don't know. And so when screening are done, we get to know numbers, we get to follow up of the cases that are available, and we implement different strategies to fight against that. And also, cancer are curable. Also, there is asthma. So among the difficulties in the respiratory system, asthma is the difficulties in the respiratory system. So health professionals should do more research and should think of things to help people, and they should treat people, and they should give them tips to avoid asthma. So according to World Health Organization, here are some interventions that healthcare stakeholders should take into consideration for remediation to improve good healthcare. Some of them included employing skilled labor force, motivating employees by giving them incentives, ensuring effective allocation and proper utilization of resources. There is also setting medical smart goals and applying PDCA, plan, do, study, and act technique. There is also establishment of detailed action plan of what to be done. And also they should invest much in medical research, updating workforce. So the healthcare professionals should spend most of their time in doing research and updating and upgrading the healthcare workforce, because diseases always change. So stakeholders in healthcare should think of motivating employees, giving them incentives, and also they can even use skill technique. They should even know the performance of the employees, how they are committed, accountability. Because when employees are not committed, or doctors are not committed, or when they are not motivated, they are not going to deliver quality services. So always stakeholders should think of even researching more about the diseases. Because a disease may keep updating itself, it may change even the way of spreading. So when the research is being done, this is going to be a good intervention to fight against the different disruptions that will become in healthcare. And also they should do what we call health equity. Health equity is going to help all our countries, be it a developing country or a developed country, to share skills, to share equipment, to share materials, so that we can keep our health in a good way. We can even keep working together, like establishment of World Health or other World Health organizations, which will be helping people to work together. So thank you very much. My name is John Peter. As I said, we need to in all sectors of production that we have, we need to emphasize on health industry, because health industry is the one that deals with our health. Thank you very much. I will jump to Ndikubwimana.